A great question is, can cataracts be prevented or reversed? To, at this point in time, it can't be reversed. Just like wrinkles on the skin, cataracts are kind of slow in its accumulation of, damage and aging, and that doesn't usually go backwards. You can prevent cataract formation. You can live very healthily, decrease the amount of exposures, free radicals, and I've seen 90-year-olds with clear lenses. You see that quite frequently. These 90-year-olds who take really good care of themselves. They exercise. They decrease all their exposures and just live really, really healthy lives, and they don't have cataracts until much later. And I recall there was I think mid-90-year-old person who just had the lens that looked like a RLE lens, a clear 50-year-old's lens, and this patient was just coming in to see me for annual exams, and I was always just told him, I'm very impressed with you. I just don't see anything there. There's all good news, but for the average person, the time does catch up to you, and you will develop that yellowing, that discoloration, the hardening of the lens, and ultimately vision that's not correctable with glasses. And at that point, definitely it's probably to your benefit to do cataract surgery, and restore your vision to where it was in your 20s and 30s. In the future, there may be, I think there was discussion that there was an eye drop, I think 10 years ago that could slow or stop or potentially reverse the onset of cataracts or the progression of cataracts. No, that didn't pan out. I think everybody would be using that if that was true. I don't think there's going to be anything like that. At least I haven't heard of anything being discovered or in the pharmaceutical pipeline to a wonder drug like that. And so lastly, we can talk about RLE. So obviously RLE can prevent cataracts too, right? You can shift up cataract surgery, deliver a lot more quality of life benefits to the patient at 50 years old rather than wait till they're 70 or 80 years old where they're qualified to have cataract surgery through insurance. But you just move that up maybe 20 to 30 years. And at that point, you can remove the lenses so that this patient will never get a cataract, and will have this forever lens and forever good vision for the rest of their lives. You will at that point fix their nearsightedness, farsightedness, astigmatism, presbyopia, or the inability to see near and far at the same time. So you can fix all of that for the patient so that they can be independent of glasses and live really full lives, go snorkeling, go skydiving, wake up and not have to go look for their contact lenses or their glasses. See everything. I think before my LASIK surgery, one of the challenges I had was just showering. I was so nearsighted, I was -10 in both eyes, and simply getting into the shower and trying to find particularly when you're at someone else's house, it's like you can't see well enough to navigate and find the shampoo bottle or the soap, or and then you come out of the shower and your glasses are fogged up. So I just remember back in the day, showering was always kind of a hassle. Anyways, thank you very much.